Asthma is a major non-communicable disease affecting both children and adults, and it is the most common chronic lung disease among children. Inflammation and narrowing of the small airways in the lungs makes it harder to breathe, therefore causing asthmatic symptoms, which can be any combination of cough, wheeze, shortness of breath, and chest tightness. According to the World Health Organization, asthma affects approximately over 300 million people annually. Inhaled medication can control asthmatic symptoms and allow people with asthma to lead a normal, active life. Avoiding asthma triggers can also help to reduce asthmatic symptoms. Most asthmatic-related deaths occur in low and lower middle-income countries, where underdiagnosis and undertreatment is a challenge. Today on your favorite Health TV talk show, we will be talking about asthma, the risk factors, the causes, symptoms, diagnosis, and of course, the management. Welcome. It's another exciting day on your favorite Health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course with me on this awesome show is the amazing
Dr. Martina Agbere is my name. Memuna, before you go that route again, how you doing?
I'm great, and you?
I'm feeling really good for myself.
Surviving Nigeria.
Of course, we will always survive.
Today we are talking about a very pertinent, non-communicable disease. Non-communicable to our viewers is something that's not infectious, right? Yeah. And it's asthma. Asthma, not only just adults, but, you know, very common among children. In fact, it's from childhood you even know that this person is asthmatic.
Is at risk.
Any life-threatening situation you've ever experienced, maybe personal or a case you may want to share?
Yes. Actually, my daughter is asthmatic.
Wow.
And, Mimuna, you don't want to even hear. When, you know, as a medical doctor, when I saw the signs...
Were in denial?
Yes, denial, actually. I was like, no, no, I don't want this. Because the first thing that happened was my son, we went on a vacation somewhere, and he went to the poultry. And before I knew what was happening, urticaria all over his body.
Oh, allergy.
Allergy. And what's this? Just because he went to where he had the birds and the pollens. So I knew that there was, I had something on my hands in the family. So of course he had allergic reaction. So when I now had my daughter, and she now started manifesting all these things that were in line with asthma, I said, Lord, the boy did not come down with asthma. I hope it's not the same thing. And of course, when she had this real cough, wheezing, I still in my mind was, no, it's not possible. So I went to the doctor, the pediatrician, and he said, it's actually asthma, and my eyes popped because it was not just wanted to confirm it. My eyes popped, and he said, don't worry, don't worry. Usually when it starts at this early age, the chances are that it will outgrow it. So that was what I held on to. My dear, she didn't outgrow it. But the beauty of it is that she's able to understand herself, and she's able to manage the situation. So, but what I didn't like at that time was most times at night, that is when the crisis usually will come. So you see yourself giving the IV,
running around,
and everything.
Not sleeping,
and I asked, how do you really feel when it comes like that, in the breathing? And she says, all that comes to mind is, Lord, just give me this last breath.
Wow.
Lord, just give me this last breath.
So I can imagine
that was very traumatic. was very traumatic. So trust me, I just carried my chair and sat beside her, ensured that I was always monitoring the vitals.
That's because you're a doctor and you could understand what. So that illiterate woman.
There was nothing like fashion, sis. There was nothing like fashion. The rug in my sitting room, I took it out.
Because everything that would cause the trigger,
flowers, I removed everything, anything they just,
friendly environment.
Exactly. But you know what? She wouldn't even rest without the AC. She would go and lie in front of the AC at the vents. Then before what was happening again, crisis. Until so
that was such an emotion. She took me on a roller coaster of emotions because I know her and I've seen her, and she's known. And the truth is that nobody has this fishy. Like you are asthmatic, and it's so overwhelming when dealing with that from childhood. Anyway, we have an expert who is very knowledgeable, and I'm sure our guests, they are all waiting. Audience, everybody, you know, at least if you know about asthma, then this is the time for you to have a refresher course to know what are the latest trends, what do I need to do, and all that. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. And today's topic is all about asthma, the risk factors, the causes, you know, the diagnosis, and even the management. And with us in the studio is the amazing, cerebral, delectable Dr. Temitope Victoria Fapohunda. Hey God, I hope I didn't murder that. Fapohunda, right? Great. She's a senior registrar at the Department of Medicine, Lagos State University Teaching Hospital. Darling, you're welcome. And you always look amazing, though.
Thank you.
With sweet smile.
Yeah. So today we want you to shed light on this thing called asthma. It sounds like a vague thing, but it's so common. So for the benefit of everyone, what's that thing? What's asthma all about?
Okay, so asthma is a chronic inflammatory airway disease. Usually it manifests with recurrent episodes of cough, chest tightness, wheeze, difficulty breathing. Those symptoms may actually go without treatment and sometimes need treatment. Usually these symptoms occur as a result of some triggers, which the individual usually would know about what the triggers are. And asthma is actually let me borrow the term, it's a heterogeneous condition in the sense that asthma itself is a syndrome. Now there are different risk factors for asthma. So it's not the same thing driving asthma in everybody, even though they all manifest with similar symptoms. So understanding that better helps us in managing the individual. So those are some of the latest things about what we know about asthma right now.
So when you say it's a syndrome, that means it's a combination of
symptoms. So recurrent airway obstructive symptoms. Usually these individuals, they have airway hyperreactivity. So their airway is hypersensitive to things in the environment that are not necessarily harmful. They are present in the environment. These are usually the things that stimulate the hypersensitivity. And then the body reacts by producing some cells. As a result of the inflammation, these cells irritate the airway and make some of the tiny airways to close up. And then there's increased production of some mucus, which is normal in our airways, but it produces too much, which also blocks the airways. So they feel this as chest tightness, difficulty breathing, wheezing, cough. And usually the symptoms are usually worse at night or early in the mornings, and then when they're exposed to specific triggers or physical activity, exercise. So usually it's something that happens recurrently. There's a pattern. So usually it would have been noticed over weeks, months, and then asthma affects all ages. Children, adolescents, adults, everybody is at risk, can have asthma.
So do you want to just talk about the predisposing factors?
Okay, so
what are the predisposing factors?
Well, the commonest predisposing factor is allergy, atopy.
Okay.
Now, atopy is a genetic predisposition to react to some things in the environment that we call allergens. These things are otherwise not harmful in the sense that they are not organisms causing infection. So common allergens include things in the home like house dust mites, which is an insect, it's not dust. House dust mites, animal fur, animal dander, so dogs, cats, so those are allergies. And then some people have food allergies, drug allergies. So when these individuals are exposed to these allergens, then of course pollen in the environment, and then mold. So these allergens trigger the symptoms of asthma. So asthma is just a manifestation of allergy in these people. They could also have nasal symptoms, rhinitis. They could have skin reactions that we call atopic dermatitis. They could have food allergies. So in a family, so remember I said allergy is genetic. So in a family, somebody may have asthma. Another person has atopic dermatitis. It doesn't mean that one person will have everything. The thing is, in the family, one or both of the parents has allergy. So it is hereditary. So usually these are things that help us in making a diagnosis of asthma, because it is actually clinical, because the symptoms come and go. Even though we have specific tests, like we do lung function tests to confirm the diagnosis, if the individual with asthma is not having an attack and is fine, you could do a lung function test and to be normal. But when you take the history, and then if there's a family history of allergy or asthma, then it makes the diagnosis more likely. So now that is the commonest risk factor, but that's not the only risk factor. So other risk factors include past respiratory tract infections, especially in childhood, pneumonias, viral infections, some bacterial infections that go, but they don't go completely. So they leave some residual damage to the airway, now making that person's airway to become hyperreactive.
Wow.
Then air pollution, both pediatric, so even from some studies have shown that when women are pregnant and they smoke cigarettes or they're exposed to air pollution, they could give birth to children that increase risk of having asthma because of those pollutant toxins crossing the mother to the fetus. And the little children, as they are growing, their airways are developing. Our lungs keep growing until the age of 20 years. So exposure to air pollutants at that point, at any point in time, could trigger the onset of the airway hyperreactivity. So that we won't be surprised where we see some people that have asthma, they don't have allergies, but their airway is still hyperreactive. So what is driving it in these people may be different. Maybe they have previously had an infection, or their environment is heavily polluted. Like some people exposed to the Port Harcourt soot, it could be a trigger, a risk factor. And unfortunately, but it is still an interrelationship between environmental factors, those are the exposures, and genetic predisposition, which now triggers the onset of the illness, and then it becomes chronic.
So before you dive into the signs and symptoms and signs of, if somebody is presenting with asthma, you made mention of food allergies and all. Are there certain food they should avoid, or are there certain kind of things in the, apart from the dust and all that? Because especially food, some people may not have all these allergies to grains or pollens or whatever, but there's something that they eat, they just know that there's a trigger. I'll give you a case in point. I was on a flight from China back to Nigeria, and on my flight there was a couple that they were coming to do honeymoon somewhere in Africa, and she doesn't know in the food we're giving in the plane, she had edema, like literally everywhere swollen, and she cannot point, because of course the chef is not right there to say this is what, and so we suspected it's something in the condiments that she might have taken, that she was, I think they terminated their honeymoon because she was coming to a place where they do seafood more. And I'm like, if you're already having allergy just in this small plane, then how would that? So, are there certain meals they should avoid, or certain condiments, or certain things that they shouldn't, be taken as asthmatic or non-asthmatic patient?
Okay, so allergy is actually a is a multi-systemic condition, and it's a specialty on its own. We actually have physicians that are allergologists. So there are actually investigations, tests, allergy tests that can be done to test for different proteins in food items, because that is what the individual is allergic to. But the common food items that people commonly have allergies to, from egg, some people have egg protein allergy, and it varies. Some people would react to egg when it's raw, but they can tolerate it when it's boiled or fried. So when it comes to food allergy, the individual has to identify the allergy. But the commonest one are eggs, nuts, and then seafood, and some fruits like pear. Some particular fruits have some protein that people are sensitized to. But when it comes to food allergy, the individual has to identify and then subsequently avoid, and the person has to know about anaphylaxis management. So that kind of person should subsequently go around with an EpiPen, adrenaline shots, because anaphylaxis, which is a very severe manifestation of allergy, can be life-threatening.
I can imagine.
So I just want to, before you talk about the signs and the symptoms, right? At what age usually is it confirmed? You can confirm that this child actually has asthma, number one. And number two, we have come to see some adults who aren't asthmatic become asthmatic.
In adulthood.
In adulthood, yes.
Yes. So for the first question regarding the age, I'm an adult physician, but at least I know that before now, unless things have changed, the pediatricians usually are more confident from the age of 5. A lot of reasons. So to make the diagnosis of asthma, apart from the symptoms, we have some tests, specific tests. So the lung function test known as spirometry. It's a test that requires a lot of cooperation, following instructions. So most times until the child is like 5, you may not really be able to perform a good quality lung function test. Then also there are some childhood illnesses, viral wheeze, bronchiolitis, that can mimic asthma, and they are not long-term. So they don't want to quickly label the child as asthma. Even though those illnesses, they may need to be nebulized, they may even be placed on inhalers, but they will still watch and see. But from the age of 5, manifesting with the asthma symptoms, most likely it's asthma. Now for the adults, so before I go to that, so in the field of allergy, there's what we call atopic match. So in an individual that has allergy, there are some allergic diseases that come at a particular age in that individual. So it starts with dermatitis. So usually you have these babies that they say they have ALA. This one is the early manifestation of allergy in that baby, in infants. Then when you start supplementary feeding, then the ones that have cow milk allergy, eggs, so they start having food allergies. So that's food allergies. Then in the early childhood, puberty, they could have rhinitis, they're always sneezing, having conjunctivitis. Then in adolescents, teens, 20s, some people now develop asthma. They are still allergic. Those illnesses are just coming at different
phases in the life of that person.
And then there are some people that don't have all these things. In their 20s or 30s, they just develop asthma. So in these people, it could still be allergy. Maybe they just didn't pay attention. They did not know they had dermatitis as a child. Some people, environmental triggers, constant exposure to things that irritate the airway until the point where their airway just became hyperreactive. And another key factor is obesity. So obesity is a risk factor for asthma in some people.
So the bigger you are,
some people that have genetic predisposition, when there's now a cofactor of obesity or pollution or other things, then the person manifests. So those kind of people would notice that when they're able to lose weight, they have control of the asthma.
So the signs and symptoms?
So usually we talk about the 4 cardinal signs, symptoms of asthma, which are cough, chest tightness, wheeze, and shortness of breath. So all the 4 symptoms does not have to be present in the person for us to make the diagnosis. Usually what is key is that they come and go. Usually the individual will know that it is when I'm exposed to either dust or cold, because their airway is hyperreactive, not just to allergens, but to irritants. So irritants are things like dust, like cold air, like aerosols, like fumes, like smoke. This thing irritates all of us. We would sneeze, cough, and be fine, but people with asthma, the irritation, the response will continue until that inflammatory episode goes, maybe after some hours, or the person uses something. So usually that's the symptoms are episodic. They come and they go. In between, they are completely fine, no fever, nothing, until they're exposed to another.
Fapohunda. I have to learn this very well. I have to learn it. But please forgive me if for any reason I'm not pronouncing it well. Now, this patient has presented with the cough, the chest tightness, the wheeze. What's the fourth one now again?
Shortness of breath.
Shortness of breath. Now you hear the shortness of breath. That's why she said consultant talking to us. And now you have to make the diagnosis before you now drop the bombshell. I think you have asthma. What are those other things that you have to do in making this diagnosis?
Okay, so the symptoms, we want to identify the pattern, if possible, if they've noticed triggers, things, and then if sometimes it goes on its own, even without doing anything, and then the times of the day when the symptoms usually occur. Then also we want to ask for family history. Like I said, asthma is very hereditary, so other members of the family or other members of the family that have other allergic illnesses that could strengthen that. Then depending on the age of the person, if the person is a child or an adult. So if the person is an adult, we want to ask for history of childhood asthma. Because some people have asthma in childhood, and then when they approach puberty, adolescence, it goes into remission. So a history of childhood asthma is a risk factor for adult onset asthma. It's just that in our own part of the world, sometimes they don't have the history, or it wasn't even identified. So it's appearing new, but it wasn't. So once we are sure that the history seems like that, so as I said before, in between episodes, these people are usually fine. So most times, the physical examination doesn't really add much, except maybe if the BMI is on the high side. That could be something important to note. Then, so the diagnostic test we usually do is we do a lung function test. It's called spirometry. So we want to measure how air moves in and out of the lungs, and then there are some values we look at that help us to know if the person has asthma. Then there are one of the major medications we use that helps to relieve asthma symptoms. That medication is also administered during the test, and then the test is repeated to see if there's a difference. So we do the lung function test, and then we do chest x-ray most times, not to diagnose asthma, to check for other things that could look like asthma, an infection, something else. Then we usually do allergy assessments in everybody coming with asthma, because it's the biggest risk factor. So we could check for specific allergens by doing allergy skin testing. We could do blood allergy testing. So basically we now try to look for risk factors, but that is our approach when we have individuals we are suspecting of having asthma.
Okay, so when you have identified all these, what is the line of management?
Yes, so asthma is very peculiar in a way because it has an unconventional treatment. First of all, when we've made a diagnosis in adults, it's important to counsel that it is a lifelong condition. It is not curable, but it can be managed to the point where the symptoms do not impact the individual's quality of life. Now, asthma is a chronic inflammatory airway disease, meaning that even when the individual doesn't have any symptoms, there's ongoing inflammation in the airway, whether they have attacks or not. And if you leave this unchecked, it could result in some permanent damage. So, which takes us back to the fact that individuals with asthma need to be on a maintenance treatment. Now, the treatment for asthma, we usually use inhalers, because, like I said, it is an airway disease. So we need medications that will act directly on the airways. And inhalers are the fastest mechanism of drugs that go straight to the airways to deliver the treatment. So we usually have two kinds of inhalers we use in asthma. So we have the inhalers we call relievers. Relievers. Usually these are short-acting. They're only meant to use them when they're having an attack, and usually it's there's a very popular blue one, or called Ventolin or salbutamol inhalers. Those are relievers. Then we have maintenance inhalers. These ones are meant to be used daily, maybe once a day, twice a day, depending on the prescription, but every day. So these maintenance inhalers prevent attacks. So when individuals with asthma are regular on their maintenance inhalers, even when they're exposed to the triggers, they may not have any reaction. So most times, when individuals with asthma use their maintenance inhalers regularly, they realize that their reliever always expires. They never get to use it.
And you've heard it from her. She's not just here to just tell you that asthma is a chronic, obstructive. No, she's letting you know that this thing called asthma has no cure, but it is manageable. And manageable means that it lies in your hands. If you are managing a child, you have to manage the child. And of course, if you're an adult, you have to do the needful. The salbutamol blue inhaler is just for short period and it's a reliever. Meanwhile, if you have been prescribed to use the maintenance one, ensure you use it as prescribed. And if you need any update, go back to your physician and get a proper update on it. Don't just buy anything you see on the way or eat anything or you think that the asthma has just gone. No, it doesn't work that way. My name remains Dr. Maimuna Yusuf Kadri, and until next time, remain blessed.
Thank you very much, Doctor, for coming again on our program. I'll be rest assured that we'll still call on you again to handle every other thing that has to do with the respiratory health. And to our viewers out there, I'm sure you had a good time listening to asthma being handled by our very delectable Dr. Fapohunda. And you have heard it also. It depends. Every patient, the reaction differs. The trigger factors also differ. What works for A may not work for B. What triggers out of A may not trigger out of B. So you have to be very sensitive to what triggers yours and know how to avoid it. Like you also heard, she said, it doesn't have treatment. It's for life, but it can be managed. And if you manage it properly, you will have a very good lifestyle. So I want to just say on this note that you just ensure that you keep a very, very good environment. Ensure that anything that triggers it, like the rug, remove it. Your health is most important. Just take it off. If you are reacting to seafood, cut it off. Anything that you know you react to, just take it away. Why do you want to stress yourself? Still managing, and at the end of the day, you find yourself in crisis. So I want to just say thank you so much for being part of our program. Remember to follow us on our social media platforms, on Instagram, on Facebook, and on Twitter. Now, X, right? And if you want to be part of this program like our doctor, you just go to our website and send us an email, and you will hear as our guest. Till next time, call your friends, call your family. Don't ever watch the physicians alone, because your health will always be our business. I'm Dr. Martina Agbemi. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.